the pandemic, I was basically flipping everybody over to Phesgo.
Yeah, same.
Except there was that occasional patient, my 78-year-old with stage 4 disease who was coming in once every 3 weeks, who her whole social life was visiting with my nurses, and she wanted those
Yeah.
5 hours in the clinic, right? We've all seen that. We've all been exposed to that. What about the opportunity to connect with patients? And based on what I just said, this woman really, she loved the infusion nurses. That was her social life. They asked about her life. She had someone to interact with when so many people were isolated during the pandemic. But as we move forward, do you think that um, we're missing something by not having that time with our patients in the infusion room? Melissa?
I, I don't necessarily, only because, that subcutaneous administration time, loading dose 8 minutes, maintenance dose 5 minutes, that doesn't seem like much time. But as nurses, we tend to multitask, right? And sitting still, knee to knee, our knees to knees with a patient while we're administering a 5 minute subcutaneous injection might be even a little bit more time than if we hang a bag and walk away. So you can get a lot accomplished in 5 minutes of administration time while you're really having to, kind of sit and push that
I totally
subcutaneous
agree.
drug.
Yeah,
You've got that quality of time when you're with somebody for 5 minutes versus
Right,
having the bag, checking the drip, and then walking away. So
right.
I,
yeah,
I do think that we're really not missing anything there.
I don't
And
either.
yeah, no, there's also a very practical issue here, and that is throughput. Um, Maria knows that I work in a center that only treats breast cancer. We have 20 treatment rooms. And if you can get somebody in and out of the room, then that room time can be used for somebody else who needs it. And the patient won't be told, I'm sorry, we don't have any treatment slots available. Do you mind coming in the next day? So it opens up space for throughput.
what I find in my own center is if I can save that patient time in the infusion room, never mind that it's beneficial for everybody who works in the infusion center, but that patient can then transition to an ancillary service, perhaps group therapy or visiting with someone for physical therapy. They're still using that time, but facilitating all of their other needs because they do have other needs.
And the patient could spend that time driving to your home for a good Greek meal, I'm sure. Also, you know,
Uh, I have been very, very devoted to patient survivorship programs. And during the pandemic, they were all virtual. Now we're starting to have live programs. And I find that patients love to come in. They love to talk. They love to hear about all of the things that we have to help them get through their diagnosis and find a way to separate who they are from that label of their diagnosis. And I think supporting patients during their treatment journey when you have education and knowledge and enthusiasm and being at the forefront of breakthrough therapies. It really is, for me, just joyous. I know so many patients have said to me 15 years in their stage 4 treatment, when are you going to have a pill? When can I stop coming in? Well, I've got a subcutaneous injection now. So
Yeah.
it affords them so much good life. Christine, do you have anything that you'd like to add to all of this?
Um, I just think we're evolving so much, and I'm so happy for our patients, like truly so happy that we have so many more options now. And, we can help them live fulfilled lives now, lives that are, it's no longer just this doom and gloom. And I think they really appreciate having us every single day and knowing that there's hope with all these new therapies.